Good morning, everybody. Ladies and gentlemen, the chairman of the Diabetes Fiji, and representatives from all the organizations that are playing an important part in dealing with this huge epidemic that besets all of us and members of this Congress. I think, first of all, I'd like just to add my words of welcome, to welcome you once again to this first ever Congress where all the parties, all the players have come together. I'd like to thank Diabetes Fiji for organizing it, for involving all the stakeholders of diabetes and NCDs. And I hope that while you're all here, that you're all enjoying good health, that you're all healthy. Because that's basically what we're here for, to talk about health. And you're all practitioners in this area of diabetes and NCDs. You know all the stats. So we all know where we are. But just allow me just to relate some of the things that I related earlier in Parliament last month, or was it this month? Probably this month. That was quite shocking to a lot of the parliamentarians. I did not know about myself, but I came to realize that diabetes has now become the second biggest killer in Fiji. Second biggest. I think the earlier stats, the earlier research that I showed earlier showed that it was number 3, but now it is number 2, so it's creeping up. And if we don't be careful, very soon it could get past cardiovascular disease and become the biggest killer in this country. So it is really, really serious. Used to be 3rd, now it's number 2. It's getting worse, and all of you know about that. The thing about all these NCDs, sometimes when you think about it, it almost appears that it's inevitable that this thing will swamp us. There's that air, sort of that aura of inevitability. And I think that's something that we need to battle. I know that we're doing a lot of work to manage it and deal with it, but that area, that aura of inevitability, that it's something that's going to swamp us, because the stats that I've seen back from the 80s just show that things keep on getting worse and worse and worse. That sort of way of thinking is something that we need to deal with. There's a belief that it cannot be reversed. That's the sort of sentiments that I'm getting. But I believe otherwise. I believe that it's not inevitable, that it can be reversed, and that we must really be focused on 2 things. Right now, the problem is already here. We need to focus on what you're doing, which is to deal with it, which is to do the kinds of things that we have here, with the objectives that we have, to help those who already have diabetes or already have NCDs so that they can live a better life. That's something that's very important. But secondly, the big thing that we have got to do over the next few years is to look at how we can reverse it. We must be able to focus on that. That is something that's very important. Reversing the trend, that is where we want to be, and we have to determine how to get there by working in partnership. The government on its own will never be able to do that. Will never be able to manage those who already have the problems right now. That's why the government is always very thankful for the work that is done by all the organizations that are here. Whether you're into research, whether you're into treatment, whether you're into providing medicines, whether you're in the business of helping people to benefit, to improve their social or economic status that allows them to make better choices, all those things are very important. It's that whole of society approach. That's the way that we'll be able to do this. And that is something that all of you are very familiar with. The government is doing its best to tackle this overwhelming problem, but it has become evident that government cannot do it alone. And those are the sentiments that I heard expressed when I attended the World Health Assembly for the first time. There's now talk about health in all policies. Every single thing that we do in a country, we must look at the health implications of it. There must be a whole of government and a whole of society approach. That's why this is very good. Because now we're talking about the government is here, our divisional medical officers are here, our wellness unit is here, and all of you who have a part to play in this. This is very important. We have, just last week in government, we have put together this document, which is a lot of you were consulted in this exercise, the Non-Communicable Diseases Strategic Plan for 2015 to 2019, that sets out the kinds of things that we want to be able to do. And there's a number of, I was just looking through this document yesterday, and it talks about a number of the big targets that we want. And these should become all of our targets, because to be able to achieve this target, all of us need to be doing something about it. Just like the goal for this strategy is to contribute to the overall goal of a healthier Fiji, and specifically to achieve a 25% reduction in premature mortality. because I think that's the key. 25% reduction in premature mortality from the 4 key NCDs by 2025. And if I'm not mistaken, that was the target set by the WHO, the World Health Organization. And it notes in this strategic plan, in order to achieve that overall target, we need commitments in a number of areas. We need a multi-sectoral approach. That's why this is important. All the different sectors. Secondly, it will require improved service delivery with integration of prevention, early diagnosis, which is where a lot of you are involved, and treatment at all levels of primary health care. A lot of you are also involved in that. And it also requires improved monitoring and evaluation. We need to know constantly where we are, how well we are doing. And we also, fourthly, we need to build capacity to deliver all of these services. Those are the 4 the areas in which commitment is required. Now let's read a number of the objectives that will be in this plan for the next, up to 2019. So just bear with me for a moment. Some of these targets include reducing the intake of salt per person aged 18 plus years by 20% by 2019, increase daily average serves of fruit and vegetables among adolescents and adults by 10% by 2019, no increase in obesity prevalence in adults or adolescents. That's a big one. For it not to increase. It will require a radical shift in how we can get people to conceptualize what a glamorous and what a good life is. I think it will require that. And that's going to be a big one. Prevalence of insufficiently physically active adolescents reduced by 5% by 2019. Prevalence of insufficiently people who are not fit, age 18 plus years, to reduce by 10%. So it's talking about fitness, then it talks about tobacco, talks about other things about alcohol, and a number of other areas. I think the important thing is these various objectives, for it to bear fruition, requires work from everybody. It requires a multi-sectoral approach. Everybody needs to become involved in this. Many of the issues that impact on NCDs and diabetes are social issues. So the solutions will need to be socially driven. I believe that one of the most important challenges that lies ahead of us in terms of diabetes and NCDs is to really have a strong approach to changing people's perception of what a good life is, what a glamorous life is. That's why I was very glad to hear about the project that has been done by Dr. Jone here and who's that chef? Robert Oliver, to talk about making good food glamorous. Because that's one thing that we really need to do. Our concept of what a good life is, that has to change. It will require a lot of things about influencing what is shown on TV and other areas like that. We really need to really need to focus a lot of activities on that. I'm thinking that we need a revolution in this country. Not Fiji. I don't want you to overthrow the Fiji First government. No. But we need a revolution in changing perception of what a good life is. Ultimately, and this is not going to be an easy thing to do, to change the perception of what a good life is. It will require activities. A lot of you are already doing that. I had a good meeting yesterday with Friends Fiji, where they're telling me about the activities that they're doing in the communities, and I'm sure a lot of you are doing that, trying to talk to people. But then when you're talking to people, then they're inundated with all of these other pictures of what a good life is that comes through TV and internet and newspapers and other things. So how to balance on that, how to change that. That's something that we also look at the ministry, how we can be able to do that. Western diets, full of processed foods, lack of exercise, and not the way forward. We must make our traditional diets more glamorous. We must make people want those traditional diets. We must have a strong program that drives people towards the kinds of things that allow us to achieve the objectives that we have in this plan over the next 5 years. And that's why this forum is good. It requires us to come together and discuss what we're all doing. And I congratulate you for taking the time to be here, investing your time to be here. I understand that this Congress is to help organize your well-meaning but different activities into a coherent establishment that will allow us to deliver the much-needed services more effectively. Because that's what we need. We need alignment and we need coherence. Everything coherent, moving together so that we can maximize the outcomes that we can have from the resources that we have. We can reduce duplication, we can make things much more efficient, streamline the processes that we have. It's a great opportunity. Today is a great opportunity for all of us to do that. From the information that has been given to me, this particular Congress has got 4 major aims: to establish a comprehensive list of all organizations in Fiji involved in diabetes and NCDs, to establish a geographical map so we know who is operating where, what their target groups are, to establish a comprehensive reporting system, sharing of information. Information is absolutely vital. Share information, share data, so we can come up with a better awareness of what's happening, so we can plan better, so we can have a greater impact. And fourthly, to create active liaisons, so we strengthen our networking in the different organizations and to allow us also to share the resources that we have. It's an opportunity to get together, to make new networking concerns, and appreciate each other's work, and of course, enjoy the hospitality provided by Diabetes Fiji. I look forward to this day being looked back in the years to come to see as a great turning point, as a great a catalyst for working together to move towards that goal, ultimately of achieving the kinds of targets that we have in this NCD strategic plan, and at the same time start the process towards reversing the trend and make sure that it's not inevitable, but that it can be changed.